好，各位观众，大家好，今天是4月26号，2021年4月26号，转眼1年多了，坚持在这儿，几乎每次都有给大家转播这个 BC 省新冠疫情的新闻简报，也感谢大家一路的支持和帮助，也对我的鼓励。那么今天呢是周一，照例呢他们会按照3个时间段，给大家公布数字。那么礼拜五呢是800多个，礼拜四呢因为是他们提早2个小时，1点钟就报了。虽然说到3点钟还会finalize 那些数据，但是呢那个书面简报的这个数据呢还是1002。到了礼拜五呢应该是800多个，所以呢好，他们已经来了，今天是准时的。照例先做一番自我介绍，先来的是卫生厅厅长 Andrew Dix。Good
afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer.
他的旁边是 Andrew Bonnie Henry.
We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, and Wednesday, we'll be providing written statements as relevant information about the COVID-19 pandemic in BC, including case counts, around 3 o'clock each of those days. Then on Thursday, we'll be back here in the Press Gallery Theatre in Victoria. And with that,
也是在维多利亚
这个
同样的地方啊，也是在省政府的省议会的这个地下室。
Thank you and good afternoon. Today we are reporting on the 3 periods over this past weekend. From Friday to Saturday, we had 881 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 847 new cases. And in the last 24 hours, 763 new cases of COVID-19. That brings our total to 2,491 new cases diagnosed in British Columbia, and our overall total to 126,249 people diagnosed with COVID-19 in British Columbia. Of the new cases, 466 were in the Vancouver Coastal Health Region, 1,632 were in the Fraser Health Region, 82 were people who lived in Vancouver Island Health Region, 206 people lived in the Interior Health Region, 104 people in Northern Health, and 1 was a case in a person who normally resides outside of Canada. We currently have 8,199 active cases in all areas of the province, and 484 people are in hospital with COVID-19 right now, 158 of them in critical care or ICU. We have 12,340 people under active public health monitoring, again all over the province, and 116,241 are in the recovered range. We've had 1 new outbreak to report since our last reporting period at Orchard Haven in Interior Health. So that brings us to 8 active outbreaks in long-term care, assisted living or independent living, and 7 in acute care facilities. Over this past weekend, we've had 17 more people who've died from COVID-19 in British Columbia, bringing the total number of people to 1,571. As always, our condolences and our thoughts go out to families who have lost a loved one during this pandemic, and also to the care providers in the communities. Our thoughts are with you during this very difficult time. And I just want to give a little more detail about the people who died over this past weekend. One of them was a person who resided in one of our long-term care homes that had an outbreak. In addition, by age group, 2 of the people who passed away over the weekend were over the age of 90. 7 were in the 80 to 89-year-old age range. 5 were in the 70 to 79-year-old, 2 in the 60 to 69-year-old age range, and 1 person was in the 50 to 59
一个是50岁以上啊，几乎都是50岁以上啊，这个也是说明了，也就是说这个悲剧啊，也是年纪越大越容易死亡。
There has been some concerns expressed in other parts of the country about people who are dying at home from COVID-19.
他说，其他国家也有些顾虑，很多人是死于在家里边的新冠这个是很可怕的一个悲剧。那么在 BC 省有一些是突然在家里边死亡的。
To understand the cause of death, and since the start of this pandemic
那么我们的验尸官都会仔细检查。
We have been working with the coroner's office
那么自从这个去年3月份以后呢，我们都把这个新冠疫情的这个新冠措施都加入到了验尸官里边的这个检查程序里边去，所以他们都会仔细检查，都会调查。所以有些呢会调查几个礼拜或者1个月，那么这个是根据复杂情况。
That COVID-19 was either a direct cause or one of the
那么有些死亡呢，有些是直接死于新冠，有些呢是死于新冠相关的死亡。那么每个亲族家属都会被通知到死亡的原因是什么。
We've had several hundred deaths that have been investigated by the
那么在过去这里呢，已经那么现在看来呢，是几百个里边已经几百个里边。看到这个相当于死亡的比例还是不高。
An infant died, an infant from the Interior Health Authority.
那么在内陆地区，今年1月份的时候是有一例是在儿童医院死亡。那么这个验尸官经过调查了之后呢，是调查下来是证明是最年轻的死于直接死于新冠的。
And I'm reporting this today as
那么今天给大家汇报
the report from the coroner's
那个验尸官的报告出来了。我们也会把验尸官的报告发到我们这个礼拜的 CDC 的这个网页里边去。
And the privacy, of course, of the
当然了，那个这个死亡的亲属啊家属的这个隐私，我们还会保护，注意保护。但是呢，会大家知道这个很悲惨的一个，就是年轻的生命就失去了。那么同时，我们也是我们过去几个礼拜看到了这个急速的上升的阳性案例，所以我们也会紧密的观察我们也是积极的调查。那么同时也是看看有些是突然死亡，但到底的原因是什么？我们也同时积极的监测。所以我也提醒每一个人，如果你是有这个自我隔离的，或者是有这个阳性的，或者是有各种不舒服的状况，请打811，或者是如果你是呼吸急促或者各种各样很急促的重症的话，你要打911。
Or with other health conditions,
我们因为这个新冠的话呢
，absolutely stretched right now, but our doctors and
因为医院的资源现在当然是紧张，但是我们的医生啊、护士啊都会积极的会照顾你。因为你是如果紧急急诊的话而且医院是安全的，而且是充满着这个机动性、效率的。
In our vaccine update, we've delivered 1,635,372 doses of the 3 COVID-19 vaccines across BC.
那么到目前为止已经是1635000多例这个疫苗了。所以我也提醒每一个人，只要你18岁以上的都去注册去了，都请大家去注册，18岁以上都。那因为我们认为疫苗是对抗疫情最有效的一个办法，所以只要你符合你的条件呢，我们都会通知你去打疫苗来预约。
I'm also hearing that some people may be concerned that the information we're collecting to be able to record your immunization and make sure it gets into our provincial immunization registry is concerned about sharing of this personal health information. I want to give vaccine. I can reassure you that that is not the case. Any information we gather is personal health information.
那么我们每一个人收集的你们每一人的这个卫生数据呢，这个隐私数据都是受到保护的。我们不会给任何一个代理机构或者是任何一个政府的这个。因为我也知道这个很多人也是担心啊，因为我是这个有一些临时的护照啊，或者是签证等等的啊，我们也会给你记录。我们的目标主要是为了保护社会安全啊，在 BC 省每一个角落、每一个社区都有安全啊，每一个居民保护他们啊。我们知道不管你是加拿大居民还是不是居民，只要你在这儿，我们都给你打啊。这个策略是对的，我们不小气啊。你主要住在这儿，你18岁以上的都可以做。他说包括了那些临时劳工签证到这我们这儿农场来工作的啊，等等都可以来打了，因为这样的话呢，也是保护我们的 BC 省的安全和社区的安全。这个策略是对的。那么同时呢，我们也是会给那些日常工作的你们都会来符合资格打的，你们都来打，不要担心，不要有你们的健康的隐私问题啊，或者是他主要是他提到了有些他没有合法的居住证明啊，真的，他也呼吁你们来打。
Concerns that people are afraid to share the pictures of themselves getting immunized. But this is an important time of hope for all of us, and everybody will have the opportunity to receive their first dose of vaccine.
所以每一个人都要有机会，都有资格来接受他们第一针的疫苗。
When we are immunized, we protect not just ourselves, but we protect our coworkers,
所以我们现在就算接种疫苗，不单单是保护我们自己，我们还是要保护，等于保护了我们家人和我们生活在一起的社区等等。所以我们也是等我们全体都打了疫苗的话，我们也要庆祝这个全民免疫。所以我也是鼓励大家。
Our goal, as we talked about, is to prevent severe illness and death, and that's why we have focused from the beginning on those most likely to experience those, and that is by age. But we also know that some people's health condition makes them more at risk. And we know that it is some people as well who are who must go into work every day, who are exposed to others in the community that put them at increased risk, and we've targeted programs at those people as well. So we want to make sure that we stop severe illness and death, and the good news is that all 3 vaccines that we have available have been shown to do that and to be very effective at preventing people from being in hospital. And there's more data that came out of the UK that's been recently published that showed that both AstraZeneca and the Pfizer vaccine are highly effective at preventing people from needing hospital care. And that is important right now when we are seeing a burden on our hospital system and on our ICU system.
这个住院，所以这个是肯定的，所以这个也希望大家有信心啊，我们一定是这个疫苗是对大家最有保护我们的系统。对不起啊，各位网友啊，图像刚才我急了没打开，说到现在给大家带来不便了，请大家原谅。
So even if you have been immunized now, it does take some time.
那么同时呢，他说了，就算你打了疫苗了，还是身上需要时间才能建立起这个抗体水平，至少3星期。所以还希望大家耐心啊。就算你现在打了疫苗，你可能还会传染。就算如果你身上有的话还会传染，还会受感染。所以就算打了之后，还是要3周以后才能够进身体里边建立起这个抗体水平。
Is more a testament to the laboratory systems we have now, particularly whole genome sequencing, that allows us to watch the natural mutation of viruses in real time and determine if there's specific mutations that give that strain of the virus a competitive advantage.
这个呢
when we talk about variants, we are still talking about people who are infected with COVID-19,
那么他说同时呢我们在谈到这个变异体的时候其实我们也在谈到人
from getting infected or passing it on to others that remain the same no matter which strain of the virus we're infected with.
同时我们也要看到他说变异体在我们社区里面发展的情况
where the virus mutations come from,
我们不管这个病毒是从哪里来 或者是印度来或者是巴西来英国来我们现在重要的是我们现在怎么如何做如何这个阻止这个传播所以希望大家还是能等在当地就是在本地能够减少接触面就减少接触面那么同时呢在室内的时候呢就戴口罩希望大家呢同时呢保持安全距离那么在室外的话也要这个保持社交距离但是呢室外呢要求不是很高那么同时呢我们也要去预约打疫苗所以我们还是要坚持接下来的几个月里边坚持该怎么做还是要怎么做我们还是要坚持始终记住这个现在这个最关键的时候最困难的时候我们还有很多的潜力可以挖你一定要记住所以还是要大家客气容让安心同时呢安全那么卫生厅长也是对过去死了17例17例里边今天他重点强调了90岁以上有2个80到89岁我记得是7个然后70到79岁又是5个然后呢60到65岁69岁以上然后50到59岁有1个所以他说那么礼拜六是5天5个礼拜天13个那么死了17个这个真的很厉害那么有1个是死于这个长期护理院的他说那现在就不知道这些老年人死亡的老年人是不是打了疫苗还是没打疫苗但是刚才伯尼医生说了就是打了疫苗之后绝对是减少了用那个住院以及重症监护的使用同时呢也是保护了我们的医疗资源不要被击垮那么那个印度出现了这种惨况这么多年纪轻的人死亡主要还是因为氧气没有那么现在卫生厅长还是给大家汇报这个医院的占用情况那么同时呢现在开始考虑就是已经实施有些非紧急的开刀要择期延期了那么同时他也强调了一下你们如果需要去医院的话千万不要有顾虑还是要去如果你要去看急诊了一定要去急诊不要担心我们都开放的医院还是事实证明是上次伯尼医生说了不是疫情初期大家对病毒一无所知现在都知道如何去管理控制这个病毒所以医院是安全的那么今天呢已经辉瑞已经收到了又是
That's 97%. We're down to effectively at the end of yesterday to 40,000 doses. We're expecting
那么现在已经是到达了预期的97%的疫苗都到了
to be available to us starting tomorrow. With respect to Moderna, we have received 354,800 doses.
那么莫德纳呢本周呢要寄望这个接收到34万那么辉瑞呢累计已经收到了100多万了那么所以呢刚才100多我没听清楚反正加起来因为现在已经有163万5千人以上接受了第一剂疫苗的接种所以这个那么他说这个礼拜呢接下来的礼拜呢就会莫德纳会收到37万那么阿斯利康我今天早上听1130呢也是很紧张就是很多人对阿斯利康疫苗有顾虑但是还有很多人是无所谓还是去打所以阿斯利康还不是说没人要的其实也是香饽饽他们也做过这些民意调查那么今天我也听到了 联邦说这个强生疫苗已经到了，今天会到一批，所以他也是鼓励感谢每一个人来注册，同时呢注册了之后他才会给你预约啊，这个我是亲身经历过了。所以他说每一个人很重要去注册，先来注册啊，因为他们这个管理机构也是现在全省是420万人是能够要打疫苗的，那么到底多少人愿意去打？那么他们还心里不知道，所以鼓励每一个人都去注册。注册了之后，他说我们这个注册系统呢都是用户界面比较友好的，很简单的。
That we have significant capacity and even greater capacity.
所以他说我们现在疫苗的到货情况还是比较乐观我们的容量还是很可观的大家不要担心这个问题。我也知道联邦政府都是在积极的联系货源我这样的话呢，我们 BC 省会有更多的疫苗会到达。特别是到5月份，我们会很乐观每一个礼拜供货量都会增加接下来的4个礼拜都会很乐观的，会看到很多的这个辉瑞莫德纳都会增加量到我们运到我们 BC 省。
Just really simple that we must continue to use our skills, follow the guidance, and adhere to public health orders. It's clear we can do this. In doing this, we must reduce hospitalizations, decrease the pressure on our health care system, and halt the postponement, reverse the postponement of more scheduled surgeries. And it's clear that we must ease the unsustainable mental and physical toll the third wave is taking on the people who take care of us. As you know, this week, we had news that a nurse had passed away from COVID-19, and we think of her. I know everyone in healthcare is thinking of her today. We've made significant and life-saving differences in our BC pandemic. Right now, 36%, 35.96 to be exact, of those eligible have received their first shot. And whether we've had our first shot or soon will, it's clear we must still make the difference we need to make in stopping the spread.
所以他也说到了，就是打了疫苗之后才能够阻止病毒的传播。所以我们现在跟病毒的抵抗武器就是疫苗。这个反反复复，这些官员反反复复恳求大家来注册、来预约这个疫苗。所以我顺便说一下，这个礼拜天我也预约了这个疫苗，因为可能是我这儿是提前允许我预约，因为我是4个星期前就注册了。我好像有给大家分享过，前个礼拜就收到了短信说，我可以去注册了，不是预约了，我注册是1个月前注册的。那么后来呢，那个了解下来呢，我们整个 BC 省呢，现在有13个热点地区的居民都可以去预约和这个他会通知你说预约这个疫苗。那么我所在的地区呢，可能也是13个地区里边的1个热点地区，所以呢我就去注册了。一开始注册呢都说你全省各个点你都可以选自己挑。那么我通过这个系统呢挑了温哥华的一个地方。那么对方呢告诉我，不是辉瑞就是莫德纳。
Hi there. I'm just wondering if you have an update on the Johnson & Johnson vaccine.
那么这位记者想问的是强生疫苗，有多少个疫苗会来？你能不能给我们数字？
Yeah, so that is also something we learned early this morning.
那么今天早上我们才知道
we are expecting Canada is expecting to receive one shipment about 300,000 doses approximately into the National Operations Center this week, sometime this week. We still don't have dates for sure, but it needs to be thawed and relabeled, and that we should expect to receive it next week. So we don't have dates yet, but we are looking at hopefully sometime next week. And yes, we have some plans. We're working through those, and we'll let people know when we finalize them. But this is a single dose vaccine.
生疫苗只要打1剂就可以了。
And it's fridge stable once it's been thawed and repackaged
而且呢，他说这个也是这个对这个包装也不是要求很高啊。那么我们在这边要重新打 label， 重新包装一下。
I'll let you.
我会一旦会知道详细情况，我会告诉大家。
The team is coming up with some recommendations that will be making public as soon as we're finalized.
我会告诉公众我们如何部署这个强生疫苗。
I do.
那么强生疫苗上个礼拜还从美国听到，好像也是用于引起血栓。
Will be on track to receive a dose of vaccine in BC by July 1st. So I'm just wondering, we're hearing that tomorrow President Biden will be announcing perhaps new changes to CDC guidelines. And what do you want people here to keep in mind until they're able to receive a second dose in terms of, both their level of immunity and potentially visiting with others this summer?
那么他也是说到了，按照你们现在的计划，7月1号之前，每一个人都能打到第1针了。那么今天呢，这个拜登总统呢又说了，指示了 BCC 那个美国 CDC 要重新做一些计划。那么是不是会影响我们今年夏天出去旅游的问题
？So that the critical mass of people being at least 21 days after dose 1.
那么他说第1针打完了之后，至少要3星期以后才能打。那么我们现在完全知道这些疫苗的时间有效性，所以我们也承诺了给大家，得到了承诺，辉瑞会增加量，因为有些打第1针的人已经4个月到了，要给他们打第2针了。
If we look at the United States,
那么他说我们看看美国的话，美国是一个很好的例子，他们那边有很多的这个传播，同时呢看到只要接种的率高的话呢，马上就是下降了。那有些州就是传播数据就下降了。那同时在以色列也是看到了急剧的下降，主要是因为疫苗的普及率同时英国也是这样，所以这个世界现实告诉我们他们这样的经历也是我们 BC 省将来也会看到这个情况，所以我们整个加拿大也会这样的情况。所以现在我们现在这个时间，我们现在还有很多病毒在这，希望大家耐心我们现在需要大家耐心的等待疫苗，等待疫苗的时候还要再耐心等待，才能阻止病毒的传播。同时呢，我们现在一定要保护我们的工作场所安全同时呢，希望大家就算要出去的话呢，也要聚集的人员少一点我们都知道这些情况希望大家也立刻行动。那么看看今年夏天我们要看到只要更多的人保护到了那么我们能够保护我们的这个医疗资源不受击垮他们的压力会更小的话，同时大家可以看看英国就是这样他们是在阿斯利康和辉瑞
both vaccines in terms of protection against hospitalization. So those are things that we're watching.
所以英国情况已经很说明问题，他们的医疗资源得到了很好的保护，所以希望大家还是耐心一点我们现在接下来的几个礼拜还是积极的去注册能够我们是使得更多的人能够得到第1针的保护这样的话我们的医院的压力就没有那么大，我们的医疗资源就不会有那么样被枯竭。现在令人担心的倒是印度这个西方发达国家慢慢科技实力经济实力都上去，那印度是发展中国家又是这个是令人担心。
Hi, thanks for taking my question. I had a question about the messaging that goes out to individuals who are in their late 50s now and early 60s, and they're on the age-based vaccine rollout. Is it your right now we're being told we must take the first vaccine that's offered to us, but when those people are waiting for the age-based rollout, if they wait for that, then they're freeing it up for the younger people. Is that part of the messaging that you'd like to get out, or are we still being told no matter what your age, take the first vaccine that's offered to you?
I'm not sure
对这个记
exactly
者
what
问
you're
的问
asking,
题，
but
他
yes,
到底为什么
if you are
搞不清楚？
registered and
他说
your
你是现
age
在都
comes
是
up
50
and
岁
you're
60岁以
said
上
it's
都
your
是已
chance to
经
book,
注册了，
book,
那么
go and get
你
your
们现在
vaccine.
就去注册，就去注册
We have,
啊，然后呢去预约。
Your deferring is not going to make it make us not going to allow us getting to that protection for everybody any sooner. So there is enough vaccine coming in the next few weeks.
所以波尼医生说了，在接下来的几个礼拜，我们有足够的疫苗到达啊，足够的让每个人都能够打到6月中旬，大家都能够打第一针了。
As we go through and cycle through the age groups,
那么同时呢，我们也是在根据这个年龄的开始让慢慢从年纪大的族群开始往年纪轻的族群开始往。
Another date is not going to get us there any faster because all of us need to be immunized, and you need to do it yourself to make sure that you're protecting
所以他说，我
yourself
们每一个人
and
都
those
要
around
保
you.
护起来，每一个人都
Where
要
we've
自己打。
had the vaccine available for younger people, and that's
那
why
么
we
同时呢，
targeted
对年
that
纪轻的
younger
人
people
呢，
who may
如果
have to
他
wait
们
longer
他们不要
for
等，
the
只能等
age-based
啊，因
program
为
is the
这个是我们的
AstraZeneca
疫苗
vaccine.
策
And
略。
in BC, we made the decision to
那
make
么
it
在 BC
available
省
through
呢，
pharmacies primarily,
那
but in
么
some
我
of
们
our
BC
high-risk
省的
communities
阿斯利
to
康呢
that
是40
age
岁以
group
上
that
都
we
可
are
以在
seeing
药
being
房可以打，
hospitalized
都可
right
以打。
now, and that's 40 to 59, and that's
现
why
在
we
是40
started
到
with that
59岁的
group.
人都能打，因
But
为这
as
些
we
人还是高风
get
险。
more supply, perhaps, maybe, and we look at the supplies that we still have in the province, we will look at decreasing the age group of availability for AstraZeneca. So that's the parallel program. But there's no reason to put it off or to think that you can defer it to somebody else. We all need to be immunized.
他也是说到了，我们没有说到某些人让他们延迟打有些某些族群或者年龄族群是让他们延迟打，没有这个说法反正就是年纪轻的人是要等这个的确是。所以今天波尼医生也是说到了，死亡的人都是这么大的年纪的人，所以一定要让他们先保护起来。
are from community transmission, and how is that happening? Have you been able to pinpoint where they came from?
Yeah, so
这位问了仔细了病毒变异体在哪里来的能不能仔细说一下？
And we treat every single one
他说我们对待每一个案例都是认真对待。
The time it takes to do a screening test and
那
then
么
to
现
do
在呢，
whole
基因
genome
检测呢
sequencing
还
to
是要有
identify
时
the
间，包
virus
括病毒的检测都是要有时
is
间。
as long as a week and
那
sometimes
么
longer.
一般
And it has
周末
changed
的话
over
呢
the
又
period
会
of
长一
time.
点。
So we do know that there's been somewhere around 40-some people who have had COVID-19.
那么我们
That
现在
turns
知
out
道
to
大
be
约
one
有
of these
40几个
variants from the UK.
那么是
When we
从英
link
国来
that
的
data back
英
with
国
the
来的
public
变异
health
体，然
follow-up
后呢
that's
我们
done
是
at
通
the
过这
time that
40几个
somebody's
人
diagnosed, there's been
跟踪接
a
触调
small
查看
proportion of
看
them
他
that
们
we can say definitely came from international
那
travel,
么有一部
primarily
分
from
里
India,
边
but also from
都
other
是从
places.
国际上来
So
的，
this
的确只
this
是小部
strain
分
of the
人。
virus is not only seen in India.
所以这个
And
印
then
度
there's
变
a
异
number
体
of
不一
them
定
where
全是
we
从印度过
cannot
来的。
link it directly to
那有些
the
呢是
vast
没有直
majority
接
of them have
连
been
接
linked
上
to
去
cases in
联
the
系起来
community.
没有直接起
So
来，
it-
有几个
it's,
没有联系起来。
it's not that easy
所以这个
to
不是
say
很
exactly
轻易的
which
说
variant is
这个病
associated
毒
with
是
which case investigation
这个病毒是
because
从
the
这个
case
人来的还是
investigation
从那个
happens
人来
at
的
the time and we don't know until sometimes weeks
那
later
么同时
whether
因为
it's a
这个也
variant
是
or
调
not.
查也要
That's
有
why
时
we
间
have
有些
gone
时间
to the weekly
复述的不
reporting
准
of the
确
proportion
那么
of
这样
our
的话
cases
呢
that
连
are
接起来就
variants
联系不
and
起来
looking for specific ones that may be of more concern, but the public health approach to every single
所以
case
但是公卫
is
系统的工作人员
assuming
每一
that
个
they
人
have
他
these
都要去
characteristics
了
that
解
we've
接触
associated with
然
the
后
variants
呢
of concern,
去
which is increased
假设
transmissibility,
这个病
and
毒
which is the
的
most
是跟
important
这个
one.
人我
And
联
we
系
are
起来
monitoring
看
very
看
carefully
这
to
个
make
图
sure
勾
that
得
there's
上
no
联系起来
vaccine
能够勾得
breakthrough
起来还勾不起来
associated
这
with
张
any
图
specific
传播
variant.
图如果勾不起来那么重
Next
新要弄
question,
所
Richard
以
Sussman, Global News.
In Fraser Health over the last week, 32 businesses closed because of exposures. Do you believe some of these exposures could have been prevented if there was a more comprehensive sick day program in British Columbia? And is that something you believe the province should put resources towards?
他说这个过去的一个周末已经有32个营业场所被关了。那么你觉得认为这些被关的这些能不能更多的能够进一步这个阻止病的传播？那么他也是说了，被关的这些呢，主要是还是除了暴露以外，还发觉在传播。那么因为现在呢，主要是工作场所，只要是有3例以上的人在传播。就算他们所以我们要让他们关闭，让他们这个隔离起来。
In ensuring that happens. So that's what we've been doing. We also are targeting, and when we can, immunization to those places where we've seen outbreaks happen.
所以同时呢，我们也是要给这些地方呢在部署疫苗，这样的话呢，能让这些工作场所建立起防线。所以，那么同时呢，也要鼓励这些工人只要生病的话，就要待在家里边。那么我也知道，这个政府呢，也是联邦政府也好，都会对这些都有帮助，都有做一些支持这些现象，可能是生病的人啊。这个卫生厅长也在那么同时呢，他说，因为有些这些福利呢，有些是联邦层面的。那么联邦和省政府呢，这个可能相互之间有一些没有覆盖的地方。那么上个礼拜呢，我们的劳务厅厅长呢，以及财政厅长呢，都在积极的这个工作在弥补这方面的漏洞。
Two odds and ends here. I'm just wondering, Dr. Henry, if you're at all concerned about Playland opening up on the weekend. There's been some concern expressed about potential spread when people are screaming or yelling on the rides. Are you concerned about Playland? And also, is British Columbia considering vaccination for pregnant women as a priority? I know other provinces are doing this, and BC has so far not made that one of the priorities.
那么他也是说，其实他问了2个问题了。
Everybody who's pregnant, when your vaccine time comes up, it absolutely is something that you should do.
他说孕妇的话，能不能可以先打孕
？And yes, we are looking at the data in British Columbia. We do know that there's an increased risk compared to other non-pregnant age
这个疫苗啊，这个对孕妇来讲，的确是有更增加的风险所以
we are working through that with the
我们也在积极的观察。
And Dr. Money, who's been leading one of the studies
across the country around
the impacts of COVID in pregnancy. So an important discussion that is ongoing. We know that the risk in younger people is still incrementally less than those by age and certain other conditions. So that is one of the factors that we need to take into account as well. But I encourage, and we know now, I know at the beginning there was some concern about whether people who were pregnant should be receiving the vaccines. There's lots of good data now that supports they are safe and effective in pregnancy, and that just last week we had a study that showed that protective antibodies are transmitted through breast milk to the infant as well. So I encourage all pregnant women to be immunized. We know that healthcare workers and others who are in those higher risk groups have been offered immunization, and they should take it up as soon as it's available to them. And we'll be looking at the data specifically from BC in the coming days. In terms of Playland, I know that's something Vancouver Coastal Public Health are working with Playland to understand risks and benefits at this time.
孩子们在叫开心唱歌跳那么这样的话能不能要传播？因为马上就要开了，所以这个伯尼医生说他也要考虑这个问题。
I wonder if you can talk a little bit more about the issue with people dying at home with COVID. I know you said it was a very small number investigated by the coroner that turned out to be related to COVID.
他说你刚才说了这个人这方面数字很少。但是还是数字，那么你们能不能告诉我们一些具体的？
Some of these people, of course, we reported on early on. We had
最早的时候
some tragic instances
这悲剧是发生在家里年纪轻的人
at home
在家里死亡。
In the last report I got from the coroner, we're talking about
上一次我是从验尸官
cases in the period from March to March, all of which would have been included in our in our reports on deaths and the death reports. But the concern was expressed in Ontario that they were starting to see increased cases with the rapid increase in numbers of people infected, that people were not accessing care soon enough. And I know there was a tragic report in the Globe and Mail about a 13-year-old girl. So this is something that we've been working with our coroner service here in BC from the beginning from last year to make sure that we did assess this, and if we started to see concerns, we could follow up with people more closely, make sure that people who needed care got it. So far, we're not seeing that happen here, but we will continue to pay attention. And I know my public health teams across the province, the people who do the case contact and the follow-up with cases every day are very aware of this and making sure that people know that they can get care. They can call 911. The paramedics know what to do to help them, and the hospitals are there for them too.
Justine, do you have a follow-up?
I do. Thank you for that. The other one is just around the vaccine supply that's coming in. You've given us some numbers around how much we're expecting in. The government website says there's 3 priority groups. There's the general population, there's the priority neighborhoods, and then there's the pharmacies. I'm wondering if you can give me a sense of the distribution of incoming supply to those different priority groups. And the priority worker
在接下来的疫苗呢，他说会大量供货。那么能不能告诉我你分这个3个部分如何分配一个呢是药房的，一个呢是这个社区的施打。
I'm not sure what you're referring to.
但是我不知道有3个部分。
The main base of our program,
我们主要的疫苗计划还是主要是通过年龄来。
As you know, as quickly as we can.
年龄为基础，所以我一直大家看到的，现在是根据这个速度越来越快，往年龄下的年纪轻的人开去打。那么
take logistically challenged to get to.
那么同时呢，有些小社区呢，货运方有困难。那么
communities where there's high risk.
那么这些呢是社区比较小、比较少数量。所以我们要调整一些政策。
Wave started and transmission has changed. So over the last couple of weeks, we've been looking at communities where there's high rates of transmission and lower rates of immunization, and that could be for a variety of reasons. Could be because it's a younger age population in that community. It could be because people in who are eligible in their 70s, for example, aren't accessing vaccine, or we're not making it available in a way that is accessible to them. So we've been doing a lot of work with our teams in every health authority to identify what are the issues that make it a challenge for people, what is the barriers for people to be immunized, and we know that some of those communities, the 13 highest risk communities where we had the least immunization, we identified those last week, and we targeted starting with AstraZeneca clinics in those communities at a younger age group. And we're looking at, we know that many of these communities are racialized communities, people who may not be comfortable with information that we're putting out from government, that we need to engage with community leaders to get people immunized. And Fraser Health is doing some amazing work in some of these communities, and we'll be doing more in the next little while. So we will continue to target. Now, given where we're seeing transmission rates, and we look at some of the communities that we're talking about in Surrey, for example, many of the people who live in those communities work in our grocery stores, work in our healthcare system, and we need to find ways to support them to be immunized as quickly as possible. And we are continuing our worker program, and we had a list of workers that we were hoping to get through in April, given what we at the time thought our supply would be, particularly of the AstraZeneca vaccine. As you know, we've had challenges with the safety signal with the AstraZeneca vaccine, meaning we had to change that program, and we've had issues now about the age that we can offer it to. So we have continued, and we focused on first responders, school staff, and child care staff. And again, because of lack of vaccine supplies, we've had to do that in a phased approach, starting with the highest risk communities. So, for example, Surrey got immunized, the fire services, the school staff in Surrey, childcare in Surrey started before some of the other areas in Fraser Health. So that continues and will continue. This week is a very stretched week in terms of amount of vaccine, but starting next week, once again, we'll be able to open that up more rapidly. But all first responders, school staff, and child care staff will be immunized.
First responder program. 也就是其他的不是宿营了，特别是那些这个救护车啊、救火啊、救命车啊等等，这个警察啊，不单单是宿营开始打，下礼拜开始全面铺开了，因为开始更多的疫苗已经来了。
Diana Law, who's 57 years old, and we've spoken with her husband. So just hoping that there's more that you can tell us about what her situation was.
Yeah, so the short answer is no. Those are personal information, and the family opts to share that. That is their prerogative, but it's not incumbent on me to share personal health information that the family owns and is part of. All I can say is that it is, as far as we know, the first nurse who was affected and died from COVID, and it is a tragedy. It is something that affects all of us in the healthcare system when one of our own passes away.
Marcella, do you have a follow-up?
I do, and it's kind of following up what Richard asked about Playland, because in the light of the 13-year-old girl dying in Ontario, do you have concerns about Playland being allowed to open when other places are not? And what kind of message does that send out about staying local if children are going to be encouraged to go to Playland if they may or may not live close to Playland?
Yeah, well, certainly that is an issue. We do not want people traveling to Playland, traveling to any other place for recreation or vacation right now, and that I've made very, very clear. I know that Vancouver Coastal Public Health is working with Playland to understand what the plans are. We do know that outside is safer than inside, but as you say, we're at a very challenging time right now in this pandemic, and this is not the time that we want to see people coming together and for recreational reasons.
Next question, Cindy Harnett, Times Colonist.
Thanks for taking my question. There are people with stage 4 cancer undergoing chemo, and they're advocating to get their second shot within 3 weeks, citing research about waning effectiveness for clinically extremely vulnerable people, and them in particular. So I know CEV people have, many have received their first doses, but will BC be considering a second shot earlier for these people on the heels of Ontario and Alberta?
Yeah, the short answer is we have looked at this in some detail, and we have a very strong team of clinicians that have been working with us, and I want to express my thanks to them publicly under Dr. Maureen O'Donnell at the Provincial Health Services Authority, and this is an important consideration. We also, and if you look at the information from the National Advisory Committee on Immunization, looked at this specifically as well. So there are a couple of important things that we need to remember. There are a whole variety of groups of people who don't or may not amount as much of an antibody response to the first dose of vaccine. And some of them have been studied, including a very small study, as you mentioned, that was done in the UK of people with certain cancers. But there's a whole group of people that have not yet been studied who may also have a similar antibody response. And I say antibody response because we do not yet know what we call the correlates of protection. How much antibody do you actually need to be protected from infection, from severe disease, from hospitalization? So there's a lot of unknowns there. And we don't yet know if it makes a difference for somebody to receive that second dose at 21 weeks or 21 days or 28 days or at 6 months or 4 months or 3 months. So just because one small study has shown that certain group of people have not yet or did not mount an antibody response. It does not take away the basic premise of the program. And so at the moment, no, the best protection for everybody is for more people to be immunized, to have that higher level of protection from a single dose, and reduce the risk in our communities by reducing the amount of virus that's circulating in our community. So we are sticking with our 4, well, it's likely to be less than 4 months given the rate that we're going right now in terms of immunization, and we will provide everybody with their second dose and as quickly as we possibly can. But it's the best protection for everyone, even people who don't mount an initial strong immune response, that everybody get protected with their first dose. So that is the advice that I've received from our experts and from the National Advisory Committee on Immunization, and that's what we'll be working through here at BC for now.
Cindy, do you have a follow-up?
That one of the important caveats around that is there are some individuals who their treatments need to be moved around depending on their immunization when they get their first dose and when they're eligible for their second dose, depending on certain types of treatment, and those are being handled on a one-off, case-by-case basis. And the other really important thing is that we are monitoring vaccine effectiveness in every single person, which is why I say this over and over again, why I'm so concerned about making sure that we get everybody's information about what dose they received when into our clinical system, so that we can monitor that, and the BC CDC is doing that and will continue to do that. So if we start to see breakthrough infections or that the vaccine effectiveness is waning in certain populations, we can change our strategy. But we've not seen that yet. We've not seen any indication of that. So we're confident right now that the best protection for all of us, including people who are immune compromised, is to get everybody with their first dose of vaccine as soon as possible.
Cindy, do you have a follow-up?
I do, thank you. So the numbers, the daily case counts today, is there anything more that you can say about the effectiveness of the no indoor gathering restrictions based on today's numbers? And I just wanted to clarify, is the death in long-term care where there's an outbreak, was that Victoria, please?
No, it wasn't in Victoria. It was in the interior health
今天是一个内陆的一个养老院爆发，长期互联爆发。
It's hard to correlate exact numbers to the measures. I can tell you that our numbers and the numbers of contacts that each case is having, that's another thing that we follow in public health. And we were seeing cases have large numbers of people that they had close contact with at the time they were infectious. And since we've put in the suite of measures that we did a number of weeks ago, and increasingly people have decrease the number of social contacts they've had, no matter what context that was in. We are still seeing that transmission is primarily related to social connections in people's homes, where they have groups of people over, when they're meeting with groups of people indoors. And that remains a challenge. Even if it is smaller numbers now, that is still where we're seeing most cases. So yes, we've seen some impact of the measures that were put in place, and that's important. But I need to remind people that the indoor settings, when you have people over, even with the best of intentions, those are risky settings right now. And we're bringing things home to our family, to our household, and it's being transmitted to everybody in the household. That is the impact we're seeing from the strains of virus that are circulating right now. They are more transmissible. So when before, if somebody got sick from a contact they had at work and came home to their family, there might have been 1 or 2 other people in the family that caught it. But now we're seeing everybody getting it. So that is why it is so important for everybody to pay attention right now. And I hear from my colleagues in the ICU, and I've said this a number of times, that they have whole families who are admitted to hospital, and an aunt needs to take care of the children because the parents are in hospital.
父母都住院了，还要这些护士还要帮忙去照顾孩子。那么夫妻2个都有一起住在重症监护。这个是一定要阻止，一定要停止，所以这个是太重要了。一定要落实安全，我们的工作场所的落实安全措施。那么同时呢，社交呢能缓一缓就缓一缓。
Next question, Daksh Panwar, Red FM.
听到了吗？伯尼医生说，他是同事那边听到太多的这些悲剧故事了都是夫妻2个同时住院家里边孩子没人照顾了，夫妻2个同时在重症监护都有。这个是太可怜了，所以卫星自媒体里边老是做一些耸人听闻的新闻同时呢，所以我也看到一个网友说这个也没有大惊小怪，因为你重症监护传出来的故事都是可悲的不可悲的故事不会到重症监护去，所以今天这个事也验证了伯尼医生说的这些话。他说他也听到同事这么说那些悲剧的故事，悲惨的故事，所以他也是恳请大家能够不要忽视这个，特别注意这个我们已经有的安全措施、安全防护。
Adverse events following immunization. So when you immunize, over 1.5 million people, there are many things that can happen to that person. Some of them will be related to vaccine, and some of them are just would have happened anyway in that time frame, whether it's a stroke or a heart attack or other conditions. We have detected the safety signal, as we've talked about, with this rare form of blood clots with one of the vaccines. And so that gives me confidence that our system would pick up if there wasn't something that was associated with the vaccine itself. But we've not had any cases of directly related to vaccine of heart conditions that I'm aware of. But I will certainly go back and check and look up what they're talking about from Israel, because I'm not quite sure what it is.
Dax, do you have a follow-up?
Yes, I do. Dr. Henry, have there been any adverse events in people who have been vaccinated so far in BC?
Yes, we have. We call them AFEs, the adverse events following immunization, and we report on those. They're on the BC CDC website weekly. I was reporting some of them, but
他说对于这个疫苗每一种疫苗的这个副作用，每个礼拜的案例我们都会更新。
Allergic reaction right after the vaccines delivered, and we've seen that with all 3 of the vaccines that we've had that we have available in BC.
我们现在 BC 省是3种疫苗，一个是现在没有死亡，没有死亡没有疫苗引起的死亡。
In the period of time of weeks after they've received vaccine, but none of them have been caused by the vaccine. But the more detailed information is on the BC CDC website, and I encourage people to have a look at that.
We have time for one more question. For everybody listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For the last question, we go to Tanya Fletcher, CBC.
Yeah, Dr. Henry, of the 17 people who died over the weekend, most were over the age of 70. Can you elaborate on why we're still seeing these high numbers, aside from lag time? Because it's been at least a month since the majority of that age group was vaccinated. So you said in the past, it's likely many might have had COVID prior to the vaccine.
这个问题相当好，我想问，他说你70岁以上都不是打了疫苗了吗？
How many didn't take the vaccine?
是不是他们有些人是没打，所以死亡？还是疫苗不工作？我们也是在跟踪。他说，每个打了疫苗之后，我们都也跟踪。有一些几个礼拜前，我也给大家汇报过一些数字。低于1%的。
So that translates into about 1,000 people who got COVID.
低于1%，也就是1000
dose 1, and a much smaller number that have got COVID after dose 2.
也就是打了疫苗之后14天以后
，some people may have been incubating in that 14-day period, and that's when they
疫苗得到了病毒感染他说这个也是我们高估了其实真正的数据还比较低。
By individuals from this past weekend.
但是这个周末死亡的十几个人具体的数字还没有因为不知道他们疫苗打了没有还是。
But I can say that the death associated with independent living facility in the interior was a person who was not vaccinated, and that most of the cases that we've seen in long-term care in particular have been people who have been vaccinated have had very mild illness.
Tanya, do you have a follow-up?
同时呢，这个人呢，
他也说是Minister Dix as well. It's been almost a month since restrictions in long-term care homes were eased. So what's the overall situation right now? I know broadly it's improved among the elderly population thanks to the vaccines, but how much is the virus still transmitting into our homes?
是这个问题问得好。他说你们现在对这个长期护理又严格限制了，已经多1个月了，还会有这个看到了长期护理院的病毒的传播。他说我们也在紧密的监测观测每一个单独案例是职员带过来的。
And we have had a few outbreaks, as I mentioned, but they have been limited. And we do the same protocols that we have been doing all along. So if a staff person or a resident tests positive, then the whole facility is tested and monitored to see if other people get the vaccine, or get the illness as well, the virus as well, if it's being transmitted. So what we are seeing is that with the high rates of protection in residents in particular, we're not seeing those ongoing protracted outbreaks. We are seeing low-level transmission, and most of the disease is mild, but not always. And so the risk has gone down dramatically in care homes, and I think that's really incredibly positive thing, and hopeful for the rest of us for once we get high rates of immunization. The other thing, of course, that we've seen is there have been cases in staff members, and we encourage healthcare workers across the board to receive their vaccine and remind them that this is important.
所以他也鼓励所有的这些这个员工就是职员、长期护理院care homes 的员工也是要积极去注册施打疫苗。那么今天的他最后一个问题呢，会是用法语回复。那么不是所有的网友、观众都是从一开始就打开我们的节目。现在呢，我再把过去3天的数字报告给大家。周5到周6是881例，周6到周日是847例，周日到周一是763例，3天总计是2491例了。其中，沿岸卫生局是466例。飞沙卫生局是1632例，岛上卫生局是82例，内陆卫生局是新增206例，北部卫生局是新增104例，还有1例呢是国际旅行获得的。那么目前为止呢，大概是8000多个活跃的案子，其中呢484个人住院，484个人住院里面有158个人在重症监护，似乎下来一点点这个4月22号上周四给大家汇报的时候是502个人住院，161个重症监护，现在是484个158个住院重症监护。4月15号是409个住院，125个重症监护所以4月22号是最高的502个住院，161个重症监护。今天是4月26号是484个住院，158个重症监护。那么过去3天呢，死亡了17例，总计呢到了1571例了。那么到目前为止呢，一共有163万5千多个人已经打了第1针或者是打了第2针了。那么各位观众，今天的这个新冠疫情 BC 省的新闻简报就给大家汇报到这儿，也感谢各位网友，谢谢你们对我的关心和支持谢谢微风我不辛苦，也感谢你的对我们的收看对我们节目的支持我们新